first at 10, a ninth person in Montana is confirmed to have coronavirus, the illness caused by the novel coronavirus. This new patient is a man in his 20s in Gallatin County. According to the Gallatin City County Health Department, they said he's in good condition at his home. A Gallatin County health officer said the man returned to Montana from Europe on March 12th and had symptoms of the virus. He was tested on March 13th and results came back today. Health leaders say the man was diligent in self-isolating, saving many potential contacts and exposures.
There are 8 other confirmed cases in Montana, and another Montanan is confirmed to have coronavirus. She was tested in Maryland, where she lives. She has no documented exposures or close contacts in Montana.
At a press conference late this afternoon, Governor Steve Bullock announced the additional case of the virus connected to a March 5th Board of Regents meeting, and he's urging anyone who was at that to quarantine and get tested.
The governor also announced some new measures aimed at stopping the spread of coronavirus. First, employees displaced due to coronavirus-related illnesses, family care, or business closures are immediately eligible for some unemployment insurance benefits. The governor says that the requirement to apply for jobs weekly is waived as long as employees stay in contact with and plan to return to their current employer. Small businesses are also now eligible for SBA loans, and the state will cover testing costs for uninsured Montanans.
So one question we've been hearing is, what's the difference, or is there one, between the flu and coronavirus? And why has coronavirus had a bigger impact than the flu when there are fewer cases?
MTN's Matt Holzapfel dives into the differences between the symptoms and some of the fears surrounding both viruses.
There are between 9 million and 45 million cases of the flu every year in the United States alone. As of the CDC's last update, there are now just over 4,000 cases of COVID-19 or coronavirus in the U.S. This begs the question, why is there so much more fear about COVID-19 than there is about the flu? The truth is, it's more about what we don't know than what we do.
They've seen the impact this disease is having on other countries. There's still so much we don't know about COVID-19, and that's why we urge you to take whatever steps you are necessary to protect your health and the health of those around you.
The numbers may not be close, but the big equalizer is a vaccine.
There's currently testing going on looking at COVID-19 antiviral medications. There's already some that address flu, so that is one other key difference. There's no vaccine for COVID, however, again, something that is being looked at and being researched and kind of encouraged to move very quickly.
At a time when coronavirus is the hottest topic in the world, Tricia says that treatment for the flu is not being pushed to the side.
The concern is that hospitals won't be able to deal with that. Currently in Cascade County, we haven't had that issue. People are still being able to be tested and treated for the influenza.
The main similarities are the symptoms. Fever, cough, body aches, and several others overlap between the flu and COVID-19. Both can be spread from person to person through droplets in the air, and neither virus is treatable with antibiotics. The main difference is the vaccine, the current ability to cure each virus, and the numbers. Matt Holzapfel, MTN News.
Right now, Cascade County is not closing some bars and restaurants. Multiple city-county health departments across the state have ordered either the closure or reduction of hours for some establishments. Gallatin County began their restrictions on Monday, while Yellowstone County, Missoula County, and Lewis and Clark County started to shut down on Tuesday. Tricia Gardner, health officer for Cascade City County Health Department, says that it's up to her whether or not to temporarily shut down or restrict some establishments in the county. She's considering all factors before any potential decision is made.
I go by the guidance of the CDC whenever I'm making those decisions and take into consideration all of the impact that that may have on our community. It's not a decision I take lightly, and I do, of course, look at what the experts have to say and discuss that with my Board of Health and my other governing bodies to help weigh those decisions.
As of right now, Cascade County does not have any reported confirmed cases of coronavirus.
In a release this evening, the Great Falls Clinic says they'll be separating sick patients from well patients. A 24/7 coronavirus helpline has also been implemented. They're asking people to call ahead before visiting the clinic. If you have any questions about coronavirus, The helpline number is available. If lines are busy, you can leave a message with the callback number. Starting tomorrow, all patients, visitors, vendors, and staff will be screened every day they enter a Great Falls Clinic facility. You can read more from the clinic on our website.